In our comprehensive approach to patient assessment within the wilderness first aid context, we now turn our focus to the sample history. This systematic method is pivotal for gathering a patient's medical history, providing a foundation for diagnosis, treatment, and planning. SAMPLE is an acronym that stands for S, signs and symptoms, A, allergies, M, medications, P, past pertinent medical history, L, last oral fluid and solid intake, and last fluid and solid output. E, events leading up to the present situation. Each element is critical for forming a complete picture of the patient's health status. S, signs and symptoms. The distinction between signs and symptoms is fundamental. Signs are observable indications such as altered skin color, pulse rate, or vomiting. Symptoms, on the other hand, are subjective experiences reported by the patient, like nausea, headache, or pain. Query the patient on their symptoms, asking them to rate their pain or discomfort on a scale from 1 to 10, with 10 being the most pain they've ever felt in their entire life, and document these findings on the SOAP note. A, allergies. Understanding a patient's allergies is crucial. This includes allergies to environmental factors, food, insect stings, or medication. Particular attention should be paid to common allergens such as aspirin or penicillin. Document all allergies to ensure safe treatment planning. M, medications. Gather comprehensive information on any medications the patient is taking, including prescription, over-the-counter, and recreational drugs. This information can significantly influence treatment choices and potential drug interactions. P, past pertinent medical history. Focus on recent surgeries, illnesses, or similar episodes relevant to the current condition. Inquire about previous treatments and medications, aiming to understand any ongoing health concerns that could impact care. L, last oral intake. Last oral intake provides insights into potential dehydration or poisoning. Ask about the last items consumed, liquids and solids, and their sources to assess any related risk. Additionally, inquire about the last time the patient urinated or defecated to gauge hydration status and gastrointestinal function. Ask about the color of the urine and the condition of the bowel movement. Was it normal, runny, or difficult to pass? E, events leading up to the present situation. Documenting the events preceding the current health crisis is vital. Understanding the circumstances can help identify potential causes and contributing factors to the patient condition. Integrating the sample history into your assessment routine enhances your ability to provide targeted and effective first aid in wilderness settings. This thorough history complements physical examination and vital signs monitoring, forming a histologic view of the patient's health status, and this information will be used in conjunction with the workflow diagrams found in Wilderness First Aid Made Easy to diagnose the patient for underlying illnesses and discover hidden injuries. Now remember, the information gathered through sample history should be recorded on a SOAP note, serving as an essential component of the patient's care documentation. Sample history is a cornerstone of patient assessment in wilderness first aid, providing critical information that informs diagnosis and treatment strategies. As we proceed, keep in mind the importance of each element of this acronym and practice integrating it into your patient assessments for improved outcomes.